3, 2, go.
Hi, Luke, and welcome back once again to the Peak Endurance Podcast.
Thanks, Isabel. Always a pleasure to be back and talking while we're working our way through and checking off another injury today.
Yes. Now, the one we're talking about today is actually the very first running injury I ever had when I first started running, and it's Itb pain. So it is quite a common one.
Yep, and surprisingly, it's actually, well, not surprisingly, it's the first injury I sustained when I was running as well. I remember years ago, I was about 11 or 12 years ago now, and training for Puffing Billy Run and thinking, I need to do some hills here. And so I went and hit the hills and ended up being afflicted by this. And now I certainly know better and know what to do. And it's not an unusual scenario we see actually with ITB. So yeah, we're going to talk all about ITB pain and how to manage it. So ITB is pretty common. It's one of the top 6 running injuries there. So we see it in anywhere up to 12% of running injuries with ITB. Females are unfortunately more susceptible to this, the same sort of reasons that we spoke about with our runner's knee pain before. So that can have to do with structure and laxity and strength, and there's sort of a number of things that go into that. But it is a common one that we see. It's not just limited to runners, so we also do see it in field athletes that require some running. But it's also been noted in basketball players as well too. Okay. But also cyclists and rowers. So triathletes can be susceptible to this because they're copying it in both ways and on both the run and the
cycling would be because of the seat height and that sort of thing.
That can certainly have to do with it. Also, pedaling technique can be a role to play there, and we'll talk a bit more about from the running perspective. But yeah, certainly from a riding perspective, it can be bike position and also then technique that's sort of causing that irritation of that ITB. So it's sort of commonly not just unique to runners. The ITB is actually big, and you can see on this image here, but it's a big structure that runs all the way down, starting from up at the top of the hip there. And the muscle component of that is called the TFL. And then it's this big tendon-like structure that runs all the way down the outside of the leg there and attaches down into the outside of the knee. So its role is to transfer force when we're running, walking, jumping and hopping. So it's got a big role to play there. And when we land, dissipating those forces there. And it's also got a role in stopping the hip from buckling inwards. So, if we're looking from here, it's stopping the hip from going in there. So providing a lot of that tensile force on the outside of the hip there. So it's a pretty important one. We used to call it, I think it was a friction issue, that the ITB was sort of rubbing against the outside of the knee there and causing pain. But we now know it's actually more a compression issue. And what's then generating the pain is there's like a fat pad that's sort of like a bit of a cushioning that's on the outside there. And this compression of the ITB against that fat pad is then what generates the pain. So it's not so much a friction issue, it's more a compression that we call it. A few interesting facts about the ITB actually is that humans are the only species that have an ITB, and that we don't have it at birth. It only develops as we begin to walk and
that's unusual for a tendon, isn't it?
Yeah, well, that's and it goes to show that its role is to play in bipedal, walking and running. So that's where it sort of develops once we start to get into those there. So yes, it's unique there. And the other thing is it's very strong. So it can actually withstand, if you were to hang 90 kilos off it and try and stretch it, it will withstand that sort of force. So it's extremely strong, and that's sort of without any contractile elements to it there as well.
So if it's so strong, we must be doing some really.
Well, what we're actually doing to it is not necessarily, we're not overstretching it, and that's one of the things that we'll talk about there as well. So we're certainly not overstretching the tendon. What we're doing is we're overloading it and putting that irritation, that compression under that fat pad there. So that's where the irritation comes there. So it's actually very rare. I've never seen it to actually tear an ITB. Yes. They're just so strong that things around there will fail before it does. So it's incredibly strong. And like other sort of tendinopathies, though, they can be prone to, because when we're dealing with running, it's we're talking about very a quick rate of contraction. So it's impact landing the ground there like this. So it has to distribute those forces very rapidly, and that's what we find is probably more important for ITB is that how quickly things are occurring. We'll also talk a little bit about that as well.
Yeah.
So what are some of the common symptoms there? It's usually pretty easy to pick with these in terms of, yes, you've got ITB. So it tends to be, people will explain pain around the outside of the knee there. So as you can see on the image here, it's usually just on the outside of the kneecap, like where this person's fingers are. Some of the common things that will aggravate it are obviously running. And often we find with this injury is that, and we see this a lot, is that that it appears almost like clockwork. Like people will get, to a certain point in the run and then it kicks in. And so it can be like, I'm okay when I start running, but then once I get to 6Ks or 8Ks, then this knee pain starts to go, and it just continues to build as I go.
So it's not the kind of injury, like there's certain injuries you can warm up into it. This is almost the opposite.
Yeah, exactly. And these are one of those ones where they tend to really build during a run that you just physically can't even run anymore. And this is what happened to me when I experienced mine. I'm just like, I can't even run. And so, we talk about other injuries, being able to run through them and certain pain levels, but this is one that you just physically can't, because it just gets to the point where you can't even run. So they do appear like clockwork, and the reason for that, we think, is that because over that period of time, other structures are fatiguing, so you've got muscles that are fatiguing around there,
so and then taking more and more load.
Exactly right. So the ITB then has got no support, and it's just like, well, I give up, and that's where we get this pain kicking in. So it is often on the peers at a certain point. We also tend to find that other activities, so things like lunges, jumping, stairs, especially going downstairs. So sort of some of the similar activities actually with the runner's knee we spoke about last time. And hills as well, especially going downhill can be quite, and that's often where these can be triggered, is that if people have done a lot of hill running, especially downhill running.
So I'm presuming it's the downhill portions of these things, because that's when it's trying to take all the force, isn't it?
Yeah, so the thing with downhill running is that one, you've got greater flight time, like you tend to be in the air a lot longer, and so with that, you're actually got gravity taking you down, so you're hitting a lot harder on the ground. So there's a lot more impact forces for your body to dissipate. The other thing that we find with that too is it's the action of the knee and the quad having to sort of slow yourself down with each and every step there. And then also just the position of the knee too. We tend to land more with a straighter knee when we're running downhill, whereas when we're uphill, we've got a little bit more bend there, and that can put that knee under the ITB under a bit of irritation.
Because it's under stretch, or
because it's more it goes under more compression. So we actually find that with the ITB, if you were to straighten your knee and you were to bend it about 20 or 30 degrees, that's a sort of most vulnerable position where it actually starts to compress the fat pad underneath there. So if you add that position alongside a lot of force and not a lot of support with things around it, then that's when this ITB and this fat pad can get quite agitated.
So why is this injury particularly more common amongst new runners?
I think because a lot of them, that they often make a lot of training mistakes. So they do too much too soon. And, mine was a classic case of that, where I'm like, I need to prepare for this hillier run. I'm just going to do a heap of up and down running on hills. So there was no real plan to that. And that's what I often see anecdotally in a lot of other patients as well. So there's firstly that. And secondly, they can also lack the strength and conditioning, that a more experienced runner has. And we do tend to see ITB appearing more in your novice runner, or people that have resumed running after a long period of time. It's sort of unusual to see it in more experienced runners that have been consistently with their mileage. So they've often ramped up too soon. They've done too many hills, and then they just don't have that strength, and that's all of some of the things that we're going to talk about.
Another good reason to ensure you have consistency in your training program.
Absolutely, and be under the guidance of a coach, because they're going to make sure that you're not going to be doing these silly things, because that's the biggest error we see in recreational runners is that it's too haphazard. They do too much too soon. And the other position as well that can aggravate that there is the squatting. So now we're going to sort of cover some tips to go through in how to manage this, and you'll see this abbreviation ITB PS. So
I haven't seen this one.
No, it's just iliotibial band pain syndrome. That's sort of what we tend to call it. So you can call it ITB compression. I mean, if we're calling it ITB syndrome, that's another name for it as well. So there's lots of different terms for that, but we just don't tend to use the word friction anymore. And saying to someone you've got ITB, well, that's, of course, everyone's got an ITB. That's the anatomy. It's like saying you've got a knee. So we just sort of tack the pain on the end of there. So there's a bit of semantics on the name there. But as we just touched on before, so firstly with dealing with these is getting your loading right, getting your training. We can see on the image here, this is our typical ups and downs of a recreational runner or someone that's not really under any sort of guidance or coaching, and they're just all over the shop. They'll run 4 times one week and then 1 the next, and just that up and down there. Whereas we can see the image on the right side, that's what we like to see, so that gradual up and
also with the cutbacks as well, to allow the body to absorb the training.
Exactly right, what we call that. So that deload week. So that's a sort of an important part of it as well too. So it's not just an exponential increase, but usually whether it's a 3 up 1 down or 4 up 1 down, it depends on the person. But that's one thing, is you really want to make sure that you get your loading right, and that you aren't doing this up and down pattern that we're seeing there on the left side. So if we go through some of the rehab, so firstly, like we mentioned before in our previous talks, but rehab should really be targeted to the individual. So that's where the advantage of doing an assessment and seeing, well, what are you deficient in? Is it do you have deficiency in your calf strength? Is it quads? Is it round through the hips there? Is it, all these sort of things? And then that allows you to then say, yeah, this is what you go away and need to work on. So we're going to talk about some exercises that you may use, but depending on what you're deficient in, well, then you will select what you need to do there. And then obviously we select the exercises according to the pain tolerance, because some of these movements can initially be sore for some with ITB, and other people it's like, no, it's fine. I can do, I can squat, I can lunge without any issues there. So the first thing we should talk about is for ITB issues is strength around the outside of the hip. So we mentioned before that the ITB, runs along the outside of the thigh there, but you've got the muscles that attach up onto the top of it. And so if we can strengthen those muscles around that hip, then that gives that certainly a lot more support, and we don't have to rely so much on the tendon component of it when the muscles there can do the job. So we often see in those with ITB, ITB pain, they have a weakness in those muscles on the outside of the hip. And also on what's called the external rotators of the hip there as well. And a good test for people to do at home, to test the strength in the outside of the hip, is actually do a side plank. Get in a side plank position and try and hold that for 45 seconds. And so we should be able to hold
without the hips dropping down.
Yeah, without the hips dropping down. So we should be able to hold that for 45 seconds on side to side. And we shouldn't have more than a 10% difference from side to side as well. So we want to see, there's not too much of an asymmetry there from left to right. So that's the first area that we want to strengthen. Now, some of the things that we can work on to work that are a side plank. So the exercise or the test of the exercise. We can do things like sumo monster crab walks as well too, and then clams is another one. I don't tend to use that one as much, but I tend to use more the banded walks and the side planks, which have shown to be a greater activation in those muscles there. As we mentioned earlier, we want to address any issues right throughout the whole body really if they're showing weakness there, because if someone's deficient in calf strength, well, then they're going to be putting more pressure on their ITB to absorb that impact shock. So we want to make sure that we're addressing all those areas in our rehab in when we're dealing with these problems, and not just sort of getting too focused on the area there itself, but thinking of the person as a whole.
And what's she doing in this second picture? Is this skaters?
Yeah, so we mentioned there, so we sort of work up towards, these exercises are, heading up to our plyometrics, which obviously we're a fan of. But before we get to that point, we can do work through things like deadlifts and single leg deadlifts, which are a bit more hip focused. And so get some work through there, but don't involve too much bend in the knee, because for really agitated ones, they can't even bend it at all, to that 20 or 30 degrees. So we can go with things like stiff leg deadlifts and working around that, building up that hip strength. Then we can go on to squats and lunges, and progressing depth. So initially, for someone that's quite agitated, they might just do it very shallow. So they might just do a shallow lunge and shallow squat to begin with there. then progressing to a step down. So step down is quite a challenging one. So that's where you're standing on a step there and then lowering down to touch the ground. So that's quite a
with or without weight for these.
So again, so you start, you can start to see what the tolerance is to body weight, but as soon as possible, try and shift the weights. I like to, again, trying to keep our rep range initially around that 8 to 10 rep range. So if they're able to do body weight and feeling pretty easy, then start to put some weight on for that. So we've got the step downs there, and then we go on to our plyometrics. So then we go on to things like starting with some jumping. So that might be some pogo jumps, it might be some counter movement jumps, some box jumps or step jumps there, and then going on to hopping on the spot. And then that's the image that's on the slide there is a lateral skater jump, where they're jumping from side to side there, and that sort of gets this real, I guess, a shearing happening around and putting a lot of pressure in through the outside of that knee. So that's certainly an advanced one, and more a latter stage exercise that we'll tend to use for those with ITB issues. So there's sort of some of the exercise options that we can use. But yeah, firstly, building up that hip strength to give the ITB some support, and then secondly, addressing any of those other issues that are around there. Cross training. So we've got a few options for cross training. So in those that have got this and that are just too sore to even run, there's a few things we can do. Walk, and walking with sort of shorter steps. So shorter steps instead of striding out. Yeah. Just keep the steps nice and short, and again, that sort of saves the knee from going through that compression position between that 20 and 30 degrees. So walking, shorter steps. Swimming, also one as well, so it tends to be sort of with the kicking there. I tend to go with either freestyle or backstroke versus breaststroke. That can sort of be a bit aggravating on it. So swimming,
just too hard.
Yeah, exactly right. That's it. And then bike or rowing. Now, bike or rowing, again, we've got to be careful with this, because, as we mentioned early on, it is something that we do see in cyclists. And it also is something that can be seen in rowers because of that knee bend, that going back and forth. So just got to make sure that that's not aggravating their ITB pain, but that's also an option too. Fortunately, with these, you don't often need too long off running, and sometimes, like what we've spoken about before, can continue to run, and that's what we're going to talk about now. Is pain-free running, and we've touched on this in our previous talks as well. Is it okay to have pain? And yes, like other conditions, it's okay to have some pain when you're running, but it must stay at around that 4 or 5 out of 10. We mentioned before that the nature of this problem tends to build up and get to a really high point. So what I'll say to the runners there is, if it does start to build up, stop as soon as it gets to that 5, because otherwise what's going to happen there is it's just continually agitating that back pad and that tendon down there, and it just takes longer to settle down. So I definitely do not try and push through high levels of pain with this. Make sure we keep it around that 4 or 5. So some sort of pain is okay. With the runs, so we obviously want to avoid to keep it flat as much as possible. If there are some hills on the track that you run around, or you live in a particularly hilly area and you can't get around it, what I'd say is run up, walk down. So you just have to sort of take a bit of a run-walk strategy there. Which is normally the opposite to what I know. It's exactly right. So it's a good time to sort of work some strength on the hills there. But that can often be better tolerated there. Yeah. And the other thing too is we want to avoid surfaces where there's a high camber. And what a camber means is it's like the lean on the surface there. So if we look at a road, it's often sort of shaped and cambered like this for drainage. And so we just want to make sure that you're not all the time running on a particular camber there. And that's I've seen some of these that have been triggered by that are running.
For me, that's what it was, because I wasn't running hills back then. I was running on the road a lot, so it was the camber. Yeah, and constantly running. And so if that is your, if you are one of those runners that is running on the road, try and switch directions. So cross from one side of the road to the other. So you're running head on or running with the traffic. But try and mix it up as much as possible there. So we do want to avoid trying to run on a flatter surface with a less camber. Volume or speed. So what we want to do is that we know that ITB issues are more related to building volume and increasing volume too quickly.
speed work can actually be introduced a bit earlier for some of these, so that some can actually tolerate a bit more speed work early versus trying to build their volume up. Yeah. So again, this can be an individual difference, but from the research, it's found that sudden changes in volume are more likely to trigger an ITB issue versus sudden changes in speed. So that's one that you can use. It potentially can introduce some speed work early on with these. Treadmill running. So another useful tip as well is that actually running on the treadmill with an incline. So
an incline, even though it can be brought on by hills.
Yeah. It's more. Remember, it's more the downhill that's the issue there. So and where we've spoke about before of walking the downhill, well, this is another option that we've got. Exactly right. So we can pop the treadmill up on a bit of an incline, and that can allow people to sometimes run pain-free with these.
Oh, wow.
And even if they're painful, they're pain on the flat. Increasing on an incline, some are like, no, this feels good, I don't have any issues there. So that can be a way to keep them going. For
the only problem is you have to run on a treadmill.
You do, that's right. And we all hate that. Well, I hate that. But so we see the one in the background there. But I'm not a fan of treadmills. But there's people out there that love it, and that's what they do.
Yeah.
So
and look, if it allows you to go for a run and get some kilometres in, then
exactly.
Especially if you're preparing for an event, then it's an awesome thing.
That's exactly right. It does allows you to keep going, keep up your fitness, and potentially work on some other things. Working on calf strength is good for that time, that incline there. So
and just when you're talking about the swimming, what about pool running?
Yeah, that's another option. Although what we've got to be careful of, even in pool running, you don't have the impact with pool running. So that's a good thing. But some find though with that knee bending back and forward, exactly right, it can still sort of compress against and irritate that fat pad. So yes, water running is an option. It's one that I don't tend to use as much. I think that's another one up there with treadmill running in terms of how much people like it.
I'd rather run on a treadmill.
Yeah. I think that's my experience too. So, but you're right. That is a potential option that could be used. We're going to talk about a little bit about running technique as well. So, speaking about running there now, running. What I've found is that running retraining, so gait retraining or changing someone's running technique, can actually decrease their pain immediately, so on the spot. So we have the running, make some changes, and the pain can decrease straight away. That's not for everyone, but there's certainly times when that's happened. And there's lots of different ways, lots of different things that can be changed with running technique. And it's important to consider when you change anything, how that's going to then impact other structures. So you don't just change something and force just disappears. You're moving force from one place to another. So you've got to always consider.
So let me know, like you hear that it's maybe this is a complete running myth, but your body knows its best way to run. You shouldn't retrain your gait.
Yep.
These are some of the things I hear that your body knows how it should run, and doing miles teaches your body the best way to run.
Yeah.
What do you have to say about that in regards to running retraining?
So I think we've got our own ways of running, and we've got a way of running, but that's, and what I'll say about running technique is that there's no single best way to run, but there can be better ways. Now, I'm not so much for altering running technique in people that don't have any issues, but certainly when people have got problems, changing their running technique can actually help them to get over those things. And because, for instance, if you've got if you're suffering sort of repetitive knee issues, and you've got a particular way of running that just so happens that your style of running does put more load on that knee, well, then we can create changes to that to shift that load away from the knee, to make the calves and feet work a little bit harder. It allows you to then stop having this recurrent cycle of knee issues. Now, that then takes, it takes time to adopt that new running technique. But then that becomes your running technique. That becomes your new normal. Yeah. And so yes, you absolutely can change running technique. People do it all the time. Yeah. And you can see running technique change a bit also as people do get better. So how they start off as a beginner, and then as they go through over the years, that can change as they develop strength in different areas, and they're able to propel themselves a lot better. Then you will see changes over time there. But you don't always need to change running technique. but you definitely can change technique. So, but some of the things that we look for with running technique and ITB issues are pelvic drops. So what we're seeing, if we're looking from someone from behind, it's the hips dropping from behind there. What we tend to see also associated with that is then the leg coming inwards. So as the hip drops, then we see the legs going. They're almost like the knees we get that knock knee appearance. So it's almost sort of, like this here, the knees will almost rub against each other. And then also we tend to see a narrow step width, so that these runners can sometimes be like running one foot in front of the other, or sometimes even crossing over the other way. And so we actually want to see a little bit of separation.
You're not talking about the length of the step.
No.
You're talking about the width of the feet apart.
Exactly right. So if you
I've never even thought of that.
Yeah, so if you were to, you were to run in sand, for instance, you'd look at the distance between where your left and your right foot. That's that gap there. And we really, it's only very small that we want to see around there, of a couple of centimetres anyway. But when we're seeing people run one foot in front of the other, almost like they're running down the line or walking on a tightrope, that and sometimes even crossing right over the other way, then that is putting a lot of force on through to the outside of that knee and putting more compression on that ITB. So that's one there. So, a good cue that you can use for there, if you're running down like a bike path and there's a line down the middle there, you sort of want to have, if you run along that line, your feet sort of are going to be touching, the left foot's going to be touching the left side, the right foot's going to be touching the right side there. So it's just a couple of centimetres in between. Make sure you watch out. If you're looking down the line, make sure you watch ongoing traffic and make sure the cyclists are not coming at you. But that is one cue that we can use. And it's only very small separation. So, when we're creating changes in this and cueing that increased step width, it's very, very minor. So, because if you try and run wide apart, it's just a really weird feeling. So it's only just a very small difference, but it makes a big change in terms of impact forces. So there's some of the main things technique-wise that you want to change.
Yes, I was going to ask about the stretch. I was told when I first started running that these stretch for runners.
Exactly. So what we know with the ITB and those that have ITB pain is that there's no increased tightness in through the ITB. So that doesn't change at all. And even with tightness through the outside of the hip there, again, they don't always have that either. So we don't need to, with stretching, you certainly don't need to stretch the ITB. That's not a reason why you get the ITB pain syndrome. This is still being taught, or I see in Runner's World, that sort of stuff, that they're still showing how to stretch your ITB. You don't need to worry about that. You can generally, most people need more strength in through the outside of the hip, and the often reason they feel tight through there is that because they're actually lacking the strength, and so it's the body's way of complaining that, hey, we're really not happy with what you're making us do here. We need some more strength in there, give it a bit more support, and then you'll find that the need to stretch it will then go away. So we don't need to, we can scrap stretching. The other thing we can scrap too is the foam rolling through the ITB. And this is
I always love having reasons not to foam roll.
That's it. So, well, no, foam rolling is good for other areas and it can be useful for others, but just not through the ITB. We don't need to be rolling the outside of the thigh there. Yes, we can definitely get into the quad, and I will, advise people to get in where the quad joins into the outside there, or also the hamstring joins in the ITB. But rolling directly down the side outside of your thigh there is not such a good thing.
And I'm assuming you mean the same with just general massage, when some therapists say I'll massage the ITB stretching.
That's right. No, we don't need to be doing that. It hurts like hell. And anyone that's had it done, and I used to do it on myself, years ago. Get the elbow and scraping it up the ITB there, and the patient was squirming around on the table. I've now since learned that we don't need to be doing that. So save the patient's torture. That's right. So, but you can do, certainly in terms of soft tissue work and massage work around the hip there, so that can
spiky ball in the hip.
Spiky ball in the hip can work quite well. So as an alternative for that, so yes, we don't need to be rolling through the outside of the thigh there, but getting around through the hip there, that can be a benefit to just give a bit of relief for those those contractile muscles up in through there, but save yourself the pain of rolling through the thigh. So that pretty much covers that covers the ITB there. So the main keys that we've got there are get your loading right. So making sure that you you're not doing too much too soon, and watching those hills. We've got the strengthening there, so particular focus on those muscles on the outside of the hip there, plus anything else that might be going on in through the rest of the body. Then we've got our tips for running, so things like running on the treadmill there, running uphill but walking downhill, making sure that we're running on a flatter surface without camber. And then we've got you don't need to so much get into the foam rolling and stretching in the ITB. That can be focused more around through the outside of the hip. But that's
I'm seeing a common theme with most of these injuries. It's to avoid it, consistent training and strength work.
Yeah, it is, and I think that's sort of two of the areas that runners fall back on, and potentially reasons why running injuries are so high, up to 50% or above, is because those two things are often done quite poorly. So having a coach, someone to guide you through that, and then also making sure that you are doing your strength. Yep.
So if someone came into you with ITB, what would you do specifically to help them?
So what we do is we'd certainly have a discussion about what they are doing training wise, their injury history, and then also other things too that can contribute to to injury, like their recovery, what's their sleep like, all those sort of things as well, their stress. That's all really important to get a snapshot for any injury or any person for that matter.
Yeah.
And then what we then do is do a thorough assessment to look at what are your strengths, what's your mobility like, what's your strength like, and we've obviously got our state-of-the-art access system here, which we can run people through to actually give numbers and say, look, you're at this level, we need you to be here. And then we put all that information together and then work out, all right, this is what we need to do. We need to get you, in terms of running or getting a coach. We need to get you doing this strength and conditioning. We need to be doing this hands-on work here to help things settle down. So whether that's by mobilizations or soft tissue or manipulation there to get things moving. But really, making a comprehensive plan to ensure that you get back to what you love to do.
Excellent. Well, that sounds like a good plan. And as we always say, it's best to get it properly diagnosed, so you're not just doing whatever, trying to fix. I was talking with someone at the gym today, and they were saying they had ITB when they first started running too, and he thought it was his knee, something wrong with his knee. So people, specifically the knee, people can get, misread what's going on, and sometimes it's best just to get it properly diagnosed.
Absolutely right. I mean, getting an accurate and early diagnosis certainly gets you on the path to recovery a lot faster, gets you back to doing what you want to do, and back out the running track.
And that's where we all want to be.
Exactly.
All right. Well, thank you so much, Luke, for helping us as runners to stay strong and healthy and running. We really appreciate it.
Thanks, Israel. Thanks again. Thank you all.
Thanks. Bye.
Bye.